Before that time.
The physics behind, for example,
another question people
reaction, the actual change in
under
mass.
the ultimate question about
During
profit.
the course of 7 years, the book was put together.
Welcome to the Scholars Chair. Tonight, a conversation with Dr. Kethurah Williams from Howard University and Dr. Lynne Holden, President and CEO of the Mentoring in Medicine organization. At Focus, is there a need for cultural diversity in the field of medicine? If so, why? How mentoring organizations can help improve diversity in the medical profession, and how do mentoring programs affect you and your healthcare needs? All that right here in the Scholars Chair.
That we suffered under, when we are the oppressor, the dominant class, let's not impose that injustice on the others.
Anybody think that you could have a just system without giving women their rights?
Everyone has an opinion, and we sit around the marketplace and talk about opinion, but what is truth?
With the shareholder, their goal is similar to the business, to maximize profit.
That belief becomes a context for development of knowledge.
Say physics is the DNA of technology because the rules for how you build new technology starts in physics.
Because Quran challenges the people. It's not only the people of the book, it challenges Muslims.
We say secular, they hear godless.
Right.
What was intended?
Watch the Scholars Chair every Monday night. And here is your host. Dr. Williams, welcome to the Scholars Chair. Dr. Holder, thank you for coming. Tell me about your Ph.D. You both have disciplines that support it, and you've earned it, and you've worked hard for it. What is your Ph.D. in?
My PhD is in cell biology and developmental biology, and the focus was really to work with the Kethurah mentors, which is a particular type of worm, and we were looking at showing how to increase fertilization with the particular sperm count that we had, because the idea was there was this release, that the calcium release that allowed sperm and eggs to be able to fertilize and produce young ones. And so we decided to do this at the lowest level possible to see if we could get that the result that we wanted, and we did, and we were able to produce we were able to produce the genes that were associated with it.
Wow, so your background is science, essentially.
Yes, it is.
Yes, interesting. What about you, Dr. Holder?
So I actually have a MD, medical degree, correct? And my job is taking care of patients in the emergency department. So for 18 and a half years, I've practiced emergency medicine in the Bronx, New York.
Oh, wow.
At a place called Montefiore Medical Center, which is the probably now 4th busiest emergency care system in the United States.
Wow, wow. And what we're talking about tonight is mentoring, right? And you're taking students and putting them essentially face-to-face with other healthcare professionals and science and healthcare professionals. Tell me, it seems to me that you're doing this because of a need for diversity in the field. Is there a need, Dr. Williams, for cultural diversity in the healthcare field?
I believe there is, because mainly we see in the world today, we have a lot of medical professionals, health professionals as well, and what happens is that a lot of them, they are related to, they're able to focus on specific fields because of the exposure that they've received. But because of the lack of cultural diversity in certain areas, many people in many minorities, for instance, African Americans, the Alaskan, the natives, the American Indians, as well as Hispanics, even though they may be interested, they are not getting that exposure. So, and then we have to look at what's going on in the world today in terms of certain minorities as well as the diseases associated with those particular minorities. Some diseases are more prevalent with certain minorities compared to the majority. And so if there is not that exposure and that understanding of what would cause that particular disease, then you'll be going down the wrong track. And what you're trying to do is to educate all the various the races, genders of the world, so that everybody is aware and can do something about it.
Dr. Holden, is diversity important?
Absolutely. As Dr. Williams alluded to, there are some diseases, we call them healthcare disparities, that occur more prevalently in patients of color. So, for example, high blood pressure, diabetes, heart disease, and even cancer are just some examples of diseases that we deal with that occur more prevalently in minorities. Also, as Dr. Williams said, it's very important to realize that different cultures deal with diseases in different ways.
Yes.
So, for example, there's something called coining in the Asian population. So we always get a case in medical school about a patient who brings their child to the emergency department who has a fever, and after you disrobe the patient and you examine them, you notice they have bruises in a pattern on their back. And the question is, do you alert social work and take action, or is this something that's a cultural? And it is. It's a form of cultural healing. So being aware of those types of practices is so important across the board. Additionally, research has been done, for example, on heart disease, heart attacks.
Yes.
And most of the research was done on white males.
Right.
And so there's something called the Levine sign, when a patient will come in and they'll be clutching their chest. Well, in males, that's typically what happens, but not in females and not in minorities. So the presentation of a heart attack or myocardial infarction can be chest pain, but it can also be nausea or dizziness or feeling of anxiety or doom. So there are many other manifestations that are made that if you're not aware of the differences, you can get into big trouble, and you can miss a serious entity, a serious disease that a patient is having.
So healthcare, at least from the doctor's point of view and examining, looking at the patient, diversity, cultural diversity is very, very important to the healthcare of the patient.
Absolutely.
Yes. Now, in educating young potential doctors to be aware of what I've heard of a coined phrase, cultural competence. I thought it was an interesting phrase, but to be aware of cultural diversity is where we're going to start, and how to treat that diverse healthcare, those symptoms that manifest themselves differently in patients is important. But tell me, how are you informing your students to deal with differences in language, differences in religious views, or how they receive treatment? How are you dealing with your students and the people that you're mentoring to effectively operate in the healthcare field like that? Dr.
Well,
Holden?
first of all, when you say the healthcare field, there are over 120 health careers.
Oh, okay.
And so it's important to remember that across the board, diversity is an issue in these health careers. And because, according to the U.S. Census, the population of African Americans and Hispanics, Alaskan Natives, American Indians are going to be increasing, we have to be aware that even though that population is increasing, the actual number, for example, of physicians, of all the physicians practicing now, less than 15% collectively are of African American, Hispanic, or Native Alaskan American Indian descent.
Gotcha.
So the practices, language, traditional healing, family, medications that maybe roots that we use to help are not passed on to the majority of physicians. So what we do with our students is that we start very young in 3rd grade, and we take them all the way up through health professional school. And the way we do that is not only through academic enrichment outside of school, it may be a school-based program, but outside what they're learning in their regular classes, but also through leadership development, communication skills, for example, through civic engagement. So what they learn with us, they become ambassadors to take back to their community, and also through mentoring. So it's a very powerful thing for a student to see someone that looks like them who's doing something that they may want to do. A 3rd grader doesn't know if they want to be a scientist or a health professional, but at least they know, look, someone who looks like me is doing this, and so I will aspire to do this if this is something that that interests me. So we're constantly having health professionals across the board, but more importantly, health professionals that reflect the students, so that they, and to hear the stories of those health professionals, because the stories are so important. A doctor may look great now and they may have a successful career, whatever that means, but they don't know where the doctor came from. You know, the doctor might have been homeless, they might have been in foster care. And for the doctor to open up and tell students that is just so powerful. It's such a powerful testament. And the students don't forget that.
Interesting. Do you have an example of this where students are facing an instructor or professor, and they're inspired by the interaction?
We have many examples actually right now in Howard University Middle School, for instance. We have medical students as well as pre-med students that have been working with the 6th through 8th grade students with an after-school program. And just the fact that they, well, many of them were women, so that was inspiring to especially the women of the students that are female within the class. They see somebody that may look maybe 10 years older than them that are actually in those fields. So that in itself was inspiring. And then when they, as Dr. Holden stated, when they talk about the various programs or various things, various parts of their life that they had to go through, it was a very inspiring, especially one of the students, we talked about being homeless, one of the students who's actually from Chicago and is a pre-med student, she actually said that she was, I wouldn't say homeless, but they were struggling. They were on the verge of being homeless. And what they had to do to get back to where they needed to be. And she was able to say that I'm going to school anyway, and she told the students about that. And so that made some of the students within the class who may have been going through the same problems, they said, oh, so I can do this, even though my situation may not be the best. So I'm going to aspire to be like you. So when these students were actually leaving, when the course was over, we had a little pizza party, and they were in tears because they said, you're leaving. And so she said, no, I'll be back, because she wanted to be there not just for the program, but to also assist them and give them that inspiration as they go along. So they exchange numbers, email addresses, they use their their electronic devices to keep in contact. And so she said that she belongs to the church as well, and she said she's going to invite some of those students to come to one of their functions so that she'll be able to introduce them to other people and keep that connection alive. So it's not just the program, it's also what goes along afterwards, the follow-through. That's what really keeps that inspiration going. So I think Dr. Holden is doing a fabulous job.
I would love to be able to just call up a graphic designer that's been in the business for a while and ask them some questions about our field. And I think a lot of people will prefer that. Tell me, what is the target or audience for your program? In other words, who are the people who are that you're targeting, whether it's involved with low income, gender, or race? Tell us a little bit about that and why you decided to target that particular audience. Go ahead.
Well, the main, as we stated before, mainly minorities. So that would include the African Americans, Hispanics, the Alaska Natives, as well as the American Indians. And we target them mainly because they are the students as well as the population where even though there may be that interest, the exposure is not there. And that may be because of socioeconomic, as you said, low income status. It can also be because of lack of the education going in the, because a lot of times they are driven to, based on the media, to do maybe football or basketball. Those are the current things that are, and you see that on television and you believe, oh wow, they're making a lot of money, maybe that's the way to go, not realizing that not everybody gets there. And so, what we try to do is to give them the options necessary to allow them to be able to get into fields that could help them and also help their community. And so that's really why we target those students, because they're the ones with the most need.
I think that is a great effort. I'm curious, what made you, Dr. Holden, What got you excited about being a part of the medical field? What made you become a doctor?
Well, that's an interesting story. So I've known I wanted to be a doctor since I was 6 years old, and really because
your
of
parents
television.
Said, you're going to be a doctor.
No, my parents encouraged me once they knew, because my parents were both educators, but it was really Marcus Welby.
Aha.
And so watching Marcus Welby,
Television
MD,
works, right?
Yes, really, I said to myself, gosh, you know, this guy's doing some great stuff. I want to do that too. And so ever since then, I knew I wanted to be a doctor and was pretty much just bound for that. So would look for opportunities, either through talking to other physicians, trying to find other physicians. My own pediatrician, an African-American male, wasn't even so encouraging of me growing up.
Yes.
So I had to pretty much find mentors. When I was 13 years old, my aunt sent me to New York. I was born and raised in Philadelphia, and she wanted me to meet one of her sorority sisters who happened to be the mother of medicine of Harlem, Dr. Muriel Pettione.
Okay.
And so I met Dr. Pettione when I was 13 years old, and she took me under her wing. And even though I lived in Philadelphia and she lived in New York, we kept in contact via phone. I would visit her, shadow her during my breaks, and she passed away in 2011 at the age of 97. So I had, you know, the benefit of almost 40 years of mentoring under her tutelage. And when I say that, it's not so much the medical aspect, but the community outreach and the advocacy that she displayed by starting various mentoring organizations.
So mentors are important.
Mentors
Tell
are
me
very
about
important.
Tell me your mentor story. Who's your mentor? And how did that person affect your decision to be a scientist?
It's very interesting. You're gonna laugh at this, but my mentor was actually a math teacher way back in first grade.
Math to science? How you get there?
Well, STEM is science, technology, engineering, and math, so I'm not far away. But my first passion was math, and I had, sometimes you get attached to somebody just because of what they do. My first grade teacher was phenomenal. I learned math and I just loved it, and so I wanted to become a mathematician. And then as I got older, I realized, I could blend the two. And so I love research, I love numbers, but at the same time I wanted to make a difference. So just by that inspiration from my math, and we still keep in contact, first grade teacher. And but she also told me, go with whatever, go with my passion. And I know one of my strengths is actually working with people. So even though math was something that I enjoyed, I didn't think that math would really help me to connect with people the way that I would like to and make a major difference. So I think that also, as well as my support from my parents. My father was an educator and my mom is a nurse. So those pieces together helped to mold me and to make me have that direct focus to be able to go into the science field. And by the way, I wanted to go into medicine. While I was when I completed my first degree, I realized that I started working, and while I worked, I met some professors. One of them was dealing with asthma, and I just loved what she did and the way that she was able to ask the whys and the where and why is this happening, and let us look at this. And then we had these conferences that we had to attend, and that also. That kind of steered me away from medicine a little bit. So because I said I wanted to answer the why question. Even though medicine was still something I was passionate about, I said, let me see, why is it that this is happening? How could it be? How could I be of a better support or better assistance in terms of helping people? And so I said, well, I could still do the medicine or still work with people in medicine, even though I do research. And basically, that's what happened. I just ended up going around right in circles and ended up working with fellow people like Dr. Holden in medicine.
Yes. So tell me, Dr. Holden, that's a good segue. Dr. Holden, tell me about the name of the organization, and tell me about the methods used in carrying out your mission.
Sure. So the name of the organization is Mentoring in Medicine Incorporated. Mentoring in Medicine Incorporated. And what we do is help turn dreamers into science and health professionals. And we do that by finding those students who are not necessarily the cream of the crop. I mean, yes, we have some students who are, but most of them are average or just below average. And we look at their future self. You know, what can they do with a bit of motivation, a bit of extra, you know, education, a bit of contact with role models.
Yes.
And we do that across the board to, again, help them to become what they would like to become.
I'm a student, and I get in contact with mentoring, Mentoring in Medicine Incorporated, right? What did I go online? Do I look for a website there? Or?
Yes. So our website is www.medicalmentor.org. www.medicalmentor.org.
And then once I do that, I'm a student, and I'm trying to find a mentor. What's my next step?
Well, it's interesting you would say that, because first of all, the student goes to the website, and then depending on their grade level, we have different programs for them.
Gotcha.
Yes. And so when I say different programs, we have community-based programs. For example, we have conferences. Conferences have been held in Philadelphia, Detroit, Atlanta, New Orleans, New York, DC. But in addition to that, we have a hip-hop stage play, healthy stage play. My daughter's name is Morgan, and so it's called Morgan's Big Biology Test. And it really teaches the students about the cardiovascular system. And the students become the class. They become part of the play. And we go through the structure, the function of the cardiovascular system, and then students actually have guided dissections of the pig's hearts. And then they come back, they each get a stethoscope, and the stethoscope, we explain to them what it is, basically a big earphone and for the body. And they get to listen to their own heart beating. And after that, we have health professionals, science professionals who impact the cardiovascular system, or whoever volunteers to come. So the students can ask them questions, and it's a free-for-all. So the students can ask any sorts of questions, and they ask some very interesting questions. So that's our community-based arm. Then our school-based arm is the after-school program Dr. Williams spoke about. That's called the Science Pathfinders program. We run that in DC and New York. Our in-class program, those are for advanced 11th and 12th graders who are thinking about a health career. That's anatomy, physiology, pathology, and health careers. So that's also in New York. And we also have, those are high school programs, middle and high school programs. For college students, we have boot camp. And it's a boot camp for students who want to go to medical school, but again, may not be the most competitive students. And so we are funded to take students who are borderline. And so they need some help with something. So it's a holistic program. We work on everything from mock interviewing to MCAT, medical college admissions test prep, to communication skills, to body language. So it's really a boot camp, a holistic 20 weeks.
So you're moving a student from where they are academically, I gather, and moving them right through what is required for whatever stage they need to go through, right? Whatever gate they need to go through, is it college or even medical school, I gather.
Or health professional school. And then lastly, we have virtual programming. So that's the way we connect the students from all across the country. We have something called the Virtual Summer Science Camp, and we've actually published on the results of that. But the idea is really to engage students via what we call synchronous e-learning. So we're having a conversation, we're teaching students live in New York, but students all across the world are looking at us and chatting. So we communicate with them through chat and also through Skype. So we'll Skype them in, and they'll explain their projects, and we'll show their projects. So there are really three sort of pillars that we use to program.
Yeah. This seems to me, I remember hearing Neil deGrasse Tyson say that the science actually makes a contribution to the economy. And it seems to me that is exactly what you're doing. You're improving the economy by making really qualified professionals go through a system that creates professionals, which is great. Links me to my question of the targeting of low-income communities. Tell me, is that something you're consciously doing? If so, why? And is it something that, or are you just taking everyone who just have a need, Dr. Williams?
So I think it's a little bit of both, because we, of course, we're targeting those minority groups, as we stated, but we are also doing it based on interest, because a lot of times you could expose students to a particular area, but not necessarily, they may not necessarily be in tune unless and sometimes they're not really interested, but somewhere along with the program, they find their niche, as you call it. They find an area of interest to them, and then they will lighten up, or they will say, okay, I want to continue this. Where do I go next? So I have some experiences. One student, and I'm still trying to connect him with Dr. Holden. He went through middle school and went on to high school. Now he's back at Howard doing pre-med.
Wow.
And he is so excited about being a part of this program. And so every time he sees me, he will say, okay, I need to, make that connection. And he's not, I wouldn't say that he's not competitive, but he also needs that extra push as well. But he really wants to make a difference. And so he wants to mentor. So he is one of those examples where some people are just coming out naturally and say, okay, I want to do this. But then there's some that you have to pull out.
That would be my next doctor that I see in the hospital, I'm sure.
Yes.
Just very quickly, how do healthcare professionals, people who are doctors now, get involved with your program?
So again, I want to clarify, it's across the board science and health professionals that we love to have volunteer with our program, and they can do that in a couple of different ways. They can participate in an event that we're having. They can participate in the after-school program. Science and health professionals come into the classroom and they do demonstrations so that the students can actually see. We're very action-oriented learning, project-based learning. So we want to create programs and projects so that the students see in action what the science and health professionals do.
How do you prep them? How do you prep them to participate in these young people who are looking for some light? How do you help
So we have training for them, because not every science and health professional can engage a group of rowdy high school or middle school children successfully. So we do have training for them, so they should not be afraid. And of course, we take donations. That's one of the ways that we stay afloat, are through donations.
And that connection is on your website,
It's on the website,
right?
www.medicalmentor.org.
That's right. That's exactly what we need to hear. We need to hear that there is hope out there for students. Now, just very quickly, just what do you think is the long-term benefit for students? Just very briefly.
Well, I think that we have dealt with, since we started, we were founded in 2006, we've impacted over 50,000 students, educators, and family members. In our program, the college program, we have a 92% acceptance rate, and every single solitary one of those students was told they cannot, should not, and would not become a physician. So I think the proof is in the pudding, that we are turning out these students who did not have any hope. But again, we go back to our motto, which is helping turn dreamers into health and science professionals.
Excellent, excellent. I wish you and the organization the best. We're in desperate need of just some good, firm role models, and you both exhibit that hope for young people. Well, we've been talking about mentoring in the healthcare field, and I can say that we've got two excellent examples here before us, in Dr. Holden and Dr. Williams. If you want to know more about the Scholars Chair, you can go online to Read One channel on YouTube, or you can just shoot us an email at scholarschair@gmail.com. I'm Khalil Shadid. Good night.
Hit it, hit it.
amazing.